Jennifer Harris sat down with one couple whose daughter was born 9 weeks premature. She has more on how the mother's instincts likely saved the baby's life. Good morning.
Good morning, Christy and Jay. Yes, an estimated 15 million babies are born too early every year. That's more than 1 in 10 babies. Despite the staggering number, many still beat the odds. Now, one state-line mom encourages other expectant women to act quickly if they suspect something may be wrong with their pregnancy.
I wasn't feeling the baby move and kick like she was.
Emily Harrison didn't realize her unborn child was in a life-or-death situation when she told her husband about her concerns.
She said, you know, something's not right, and we kind of had this conversation, and she said, no, I think it's something.
So 9 weeks shy of her due date, they decided to listen to her instincts and get medical attention immediately. Emily drove herself to Swedish American Hospital.
They put me in a room, put me on a monitor, couldn't find her heart rate. They finally found it, and it was down in like the lower 60s. And I think it should be like mid 100s.
With a heart rate that low, this is now an emergency, and time is of the essence.
I was here for maybe a half hour before she was actually born.
Hadley was delivered 9 weeks premature, her umbilical cord wrapped around her neck. But now she's healthy and alive, thanks to her mother's instincts. Doctors say regularly monitoring an unborn child is critical to a successful pregnancy.
Babies generally by about 32 weeks will develop patterns of movement when they seemingly are predictably awake and asleep.
Kick counts are a way to measure your baby's movements once a day, at the same time each day. Doctors encourage expectant women who are at least 6.5 months or 27 weeks or more to monitor their baby's movements using this method.
Generally recommend that the woman is quiet, is not really doing much of anything else. Have her lay on her left side with her hand on her abdomen, and then feel with her hand or sense internally when the baby's moving.
It's always better to err on the side of caution. So if your baby does not move at least 10 times in 2 hours, or if there is a sudden decrease in movement, you should call your doctor. Oh my God. Baby Hadley has been given a second chance at life, thanks to her mother who chose to listen to her body and instincts rather than ignore them.
This woman educated herself. She came to the office, she asked questions. She was a reliable patient who had a consistent prenatal care. And there's no substitute for a smart patient.
We're just fortunate,
Definitely just trust your instincts. If you have any doubts, go to the doctor.
If you are pregnant and experiencing any type of pain or something doesn't quite feel right, it's better to be safe than sorry. Contact your healthcare provider immediately.
It's a good point.